terrific introduction, so I probably don't need to say anything else about myself. The only thing is that I'm not sure if this is how you want to do things with this presentation or not, but usually when I teach, I invite people to ask questions or make comments as I go through. So if anybody has questions or comments as I'm talking, please just ask straight away. I'm happy to have quite an interactive presentation if that works for you guys. If not, that's fine as well. So the presentation today it's called Cognitive Behaviour Therapy for Substance-Related Difficulties, Key Considerations. It's not going to be a heavily theoretical lecture. Really what I want to talk to you about is some key factors that we need to think about when we're working with people who've got substance-related difficulties. Most of the research in this area is done on people who have alcohol use disorder, just because it's a lot easier to find people who have alcohol-related difficulties than it is people who have illegal substance-related problems, so heroin, marijuana, and those sort of things. But nevertheless, a lot of the key considerations are very similar regardless of the substance that the person's actually using. So a little bit of an overview of what the lecture presentation today will look at. Before we start talking about treatments specifically for substance-related difficulties, I'm actually going to ask you guys to think about your own substance use. Most of you probably are substance users, and we'll get to that in a minute. I mean, I certainly am. I don't know if you can see I'm drinking coffee as we speak, but I am. So I'm going to get you to think about your own substance use and ask the question of why do people use drugs? Because it's an important thing to think about before we start working clinically with people who have drug use difficulties. Then we're going to look at when does substance use move into being problematic? You know, because most people use substances non-problematically. When does it start to become a problem? Right. And then we'll start talking about some key considerations in terms of treatment for people with substance-related difficulties. So, and I'm asking you guys, I don't know if you want to talk and speak up with me about this, or if you just want to think about it for yourselves for a minute. But why do people use drugs, or why do you use drugs? So I'll give you a minute to think about that. Oh. Recreation. So that's it. Absolutely a fantastic answer. So, and when I talk about drugs here, you know, I'm talking about any substance that I guess alters your mood. You know, so for me, the major substance that I use is coffee or caffeine. I do drink alcohol, not a lot, but okay. So to escape reality. So what do you mean by to escape reality? Yep, so some energy, yeah, caffeine boost, that's definitely a big one for me. I've got two young children, so I don't get a lot of sleep, so I do use a lot of caffeine. Now, peer pressure, that's an interesting one, isn't it? You know, friend circle. So there we're looking at a slightly different motivation. So we've got recreation on one hand, and then two other responses there: to escape reality, or counter suffering, and to peer pressure to stay in our friend circle. So to some extent, we've got positive reasons for use, recreation, energy, whatever, and then we've got, I guess, negative, if you like, reasons for use. You know, counter suffering, peer pressure, and it's those second group of reasons that tend to relate to problematic substance use. But even then, in most cases, if you're using substances to counter suffering or to escape reality, usually the substance that you've used initially was used for a positive reason. Not always, but usually. Anyone else got anything that you want to add to that? So there's just this quote that I've got on the... Can everybody actually see this slide? I can't tell what you guys can actually see when I'm presenting here. Can you see the slides that I'm presenting?
Yes, we can see all the slides. We can see your presentation.
Thank you very much. So this is a quote here, you know, that basically what it's saying is any substance that we use, we basically use to alter our conscious experience. Now, that might be to give us a bit more energy and wake us up, as you know, with caffeine or some other substances. It might be to relax, calm us down, you know, which people, you know, might drink alcohol. People smoke cigarettes to relax, even though nicotine is a stimulant, which is interesting. Now, there's lots of other ways that we can alter our state of consciousness, but substance use is an easy way to do it. So I'm not sure if anybody sort of has any sort of comments about that there. But the point is that the first key thing that I want to say to you guys, if you are interested in being a clinician who works with people who have substance-related difficulties, is the first thing that you've got to be able to do is you've got to be able to understand that drug use is a functional behaviour. Certainly, it can create a lot of difficulties and a lot of problems with people. I'm glad to hear that you agree, Divya. It's a functional behaviour, and if you can't take the time to understand the functions of drug use for your client, then you're not going to be able to help them. And there's a lot of different reasons for that. But one is sometimes for people, right, if you take their substance or their drug away from them, that can be the worst thing in the world for them in that moment. So to help a client change drug-related behaviours, you often need to find methods or find things to help them replace their drug use. And I'll talk about that later, but just taking something away is not usually useful. Often they need new skills, new coping mechanisms, new social networks, and various other things. So the first thing the first point that I want to make is that to be a clinician in this area, to be an effective clinician in this area, you need to suspend your judgment. And part of that also means not really basing your judgment on the type of substance that the client's using. In my personal experience, most of the clients with substance use disorder that I've worked with have used alcohol as a problematic, as their drug of choice. I've worked with people who used various other legal and illegal substances, and most of the factors that we're going to talk about are similar regardless of the substance. Obviously, illegal substances add a layer of complexity because of the legal issues, but we'll come back to that later as well. As I said, guys, if you've got any questions as I go through, just please just either speak up or type. I've got the chat open here, so I'm happy to answer questions as I go through. Now, we're not going to spend too long on this, but I don't know how many. There's sort of 45 or 50 people in this meeting. Let's go with coffee. Who? I mean, I'm probably not going to get a show of hands, obviously, in an online environment. But my guess is that quite a lot of people here drink coffee. I don't know if anybody wants to say yes or no or whatever on the chat. I certainly do. One of the things that I would just want you to think about for a second is how would your coffee, let's just stick with coffee, your coffee experience differ if coffee was illegal? Anyone want to comment or speak up? Yeah. So increase the excitement of it. That's interesting. But we'll still consume it. So it's interesting, isn't it? And I'm sure other people have got things that you would add to this, but the point is that the legality or otherwise of a substance, yeah, we'll find various methods to get coffee, right? Now, that's actually a very interesting point. I'll come back to that. But the legality of a substance, whether it's legal or illegal, actually changes the use experience for people. You know, so sometimes an illegal substance can be exciting, particularly if it's difficult to get, but sometimes it can also be scary to use, or you need to use it in secret or in private.